Alright, I'm a doctor of pharmacy and a licensed pharmacist, and these are the medications that I bring when I travel.
First off, I got Dramamine, less drowsy. Active ingredient is meclizine. This is a first generation antihistamine.
There are a lot of different receptors that play into like nausea, vomiting, like histamine receptors, dopamine receptors, serotonin receptors, cannabinoid receptors, neurokinin receptors, muscarinic receptors, etc.
But yeah, I got seasick, so I bring this. Next, we have Pepcid or famotidine. This is an H2RA or histamine 2 receptor antagonist. It's really an inverse agonist.
I get a lot of acid sometimes. I like Pepcid because it works within like 30 minutes.
Next, we have Pepto-Bismol or bismuth subsalicylate and Imodium or loperamide. This is for mild traveler's diarrhea, so no fever or blood in stools. Pepto-Bismol has mild antacid effects, has some antibiotic activity and anti-inflammatory activity. Loperamide I talked about before is an opioid that acts in the periphery. Next, we have melatonin.
Melatonin is good for jet lag. You don't need massive doses. I just kind of take a nibble out of it. Of course, I like the gummies.
I don't go anywhere without Tylenol and ibuprofen.
I use ibuprofen when I get like period cramps.
I also bring Lotrimin Ultra or butenofine. I feel like every time I go on vacation, I get my feet wet. This is for athlete's foot. This is not something that I usually bring on vacation, but if you're going somewhere that you might get like ate up by bugs, some cortisone cream or hydrocortisone doesn't hurt. It's a weak steroid. I always bring sunscreen. I bring like a crisp. I like the sprays. They have a limit on like the size you can bring on an airplane. This is what I use on my face. I also always bring a travel hand sanitizer because wherever I'm going, it's probably nasty. Just kidding. I don't know. I just get grubby wherever I go.